Donald Winnicott's psychoanalytic theory offers profound insights into the development of the self, human relationships, and the importance of environmental factors in emotional health. His ideas, shaped by his work as both a pediatrician and psychoanalyst, remain central in clinical psychology. Here's a structured outline for a lecture aimed at master's students in clinical psychology with a creative and accessible approach. Lecture title: Donald Winnicott's Psychoanalytic Theory, Holding the Space for Self to Emerge. Introduction to Winnicott's Life and Work. Background: pediatrician and psychoanalyst, worked with children and parents during World War II. Key influence: studied under Melanie Klein, yet diverged in his focus on the environment and its effects on emotional development. Core question: how do early experiences, particularly with caregivers, shape the true and false self?
Key concepts.
1. The true and false self, true self, emerges from spontaneous, genuine interactions with the world, representing the authentic core of an individual. False self develops as a defense mechanism, where the individual conforms to external expectations, hiding their true needs and feelings. Clinical implications: exploring how patients may have developed a false self due to a lack of authentic, responsive care during early development. 2. Good enough mothering. Concept: good enough mothering does not require perfection, but rather the ability to respond sensitively to a child's needs most of the time. Key role: the mother or primary caregiver provides a secure base, allowing the child to explore and develop autonomy. Failure and repair. Winnicott emphasized that occasional failures in caregiving, followed by repair, help a child develop resilience. Half 3. The holding environment. Definition: the psychological and emotional space a caregiver creates for a child to feel secure and contained. Developmental importance: in this safe space, the child can develop trust, explore emotions, and gradually understand the external world. Therapeutic parallel: in therapy, the clinician replicates this holding through empathy, attunement, and creating a non-judgmental space, allowing the client to explore and grow. 4. Transitional objects. What are they? Objects like a teddy bear or blanket that children use to bridge the gap between the mother and the external world. Psychological function. These objects represent the first step in the child's capacity to differentiate between self and other, marking the emergence of subjective and objective reality. Clinical perspective. Winnicott's work with transitional objects underscores the importance of symbolic spaces and objects in navigating emotional life. 5. Play and creativity. Play as therapy. Winnicott believed that playing is central to emotional health. Through play, children and adults can express emotions, explore relationships, and make sense of their inner world. Creative potential. In both childhood and adulthood, creativity represents the ability to engage with life authentically. Winnicott viewed creativity not as artistic talent, but as a way of relating to the world with openness and flexibility. Implications for treatment. Encouraging spontaneity and play in therapy allows patients to reconnect with parts of themselves that may have been stifled or suppressed.
6. Regression to dependence. Therapeutic process. In therapy,
Some patients need to regress to earlier stages of development, where they can re-experience dependence on a holding environment that may have been missing in childhood. Repair and growth. This regression is not pathological, but a necessary step for healing and reintegration of the true self. Winnicott's contribution to clinical work. Non-interpretive stance. Unlike traditional Freudian analysis, Winnicott prioritized creating a space for the patient's experience to unfold rather than interpreting it. Emphasis on relationship. The therapeutic relationship, mirroring the holding environment, is central to fostering change. Working with the false self. Therapy with patients who have developed a strong false self is slow and delicate, focusing on building trust and encouraging the emergence of the true self. Discussion of Winnicott's theoretical impact. Influence on object relations theory. Winnicott contributed significantly to object relations theory, emphasizing how early relationships form the blueprint for future relational patterns. Modern applications. His concepts are widely used in attachment theory, developmental psychology, and trauma work. They offer clinicians a framework for understanding complex cases where early environmental failures have left lasting emotional scars. Conclusion: The therapist as the good enough caregiver. Winnicott's legacy is about the delicate balance of presence and absence in human relationships. Just as the good enough mother facilitates the child's growth by being responsive but not overbearing, the therapist must also provide a space that encourages the patient's authentic self to emerge. This balance is at the heart of his theory and continues to inspire therapeutic work today. This structure can guide your lecture while keeping it engaging and relevant for students, integrating theoretical aspects with clinical applications.